A 30-year-old woman complains that she has had difficulty swallowing along with a feeling of fullness in the anterior neck for the past week. She reports recovering from a mild upper respiratory tract infection 1 month ago. On physical examination, her temperature is 37.4 degrees Celsius, pulse is 74 per minute, respirations are 14 per minute, and her blood pressure is 125 by 80 mmHg. Palpation of her diffusely enlarged thyroid elicits pain. Lab studies show an increased serum free T4 level and a decreased TSH level. She is seen by an endocrinologist 2 months later and no longer has these complaints. The free T4 level is now normal. Which of the following conditions is most likely to have produced these findings?